Good afternoon, ladies and gentlemen. I, Rukhsar Ali, student of MSc Medical Technology program,
and I, Tanya Narona, a student of BSc Medical Technology program
from Symbiosis Institute of Health Sciences, Pune, will take you to an exciting session of reimagining the landscape of allied healthcare professions in India. Allied health professionals play a critical role and are the support pillars of the healthcare team. They are trained to perform technical and practical tasks to support in diagnosis, treatment of illnesses, and referral plans recommended by medical and healthcare professionals. With the aim of regulation and standardization of the education of allied health professions in India, the National Commission for Allied and Healthcare Professions Bill was enacted in 2021. The Act aims to establish a central statutory body as a National Commission for Allied and Healthcare Professions. So in this session, we will be learning about regulations at both national and state level, education and role of allied healthcare professional associations, as well as opportunities and training from the recruiter's perspective.
Can we have a big round of applause for Dr. Shabnum Singh, Principal Advisor of Health Policy, Dr. Senthil Kumar, Principal, Sri Ramachandra Institute of Higher Education and Research, and Mr. Jithin Sree, the General Secretary of Indian Association of Respiratory Therapy, United Arab Emirates, and Dr. Niranjan Ambekar, Nephrologist, Kidney and Dialysis Center, Ambekar Hospital. Now, let me introduce you to a luminary in healthcare, Dr. Shubnum Singh, an alumnus of Lady Hardinge Medical College, Delhi, having 4 decades of rich experience in various aspects of healthcare. She is an active member of the Confederation of Indian Industry, National Accreditation Board for Hospitals and Healthcare Providers, and a contributor to task forces on artificial intelligence, medical technology, health insurance, public health, policy, and governance. Ma'am is also a founder member and currently advisor and governing board member of the Health Sector Skills Council. Apart from this, she has many more feathers in a very colorful cap.
Going ahead, I would like to introduce Dr. S. Senthil Kumar, Principal, Sri Ramachandra Institute of Allied Health Sciences. He is also the General Secretary at Association of Anatomists, Tamil Nadu. Being a professor of anatomy, he has a rich teaching experience of more than 25 years and has received many awards like the Dr. APJ Abdul Kalam Award for Scientific Excellence, Professor T. Jayavelu Award, and Professor M. Cooper Award for the Best Paper Presentation in Association of Anatomists, Tamil Nadu. He is also a peer reviewer for various scientific journals.
I am delighted to introduce Mr. Jithin Sree, the General Secretary of Indian Association of Respiratory Therapy, United Arab Emirates. Being a trained respiratory therapist, he is also practicing as a lecturer and the Superintendent of Laboratory Affairs at the Respiratory Care Department of Prince Sultan Military College of Health Sciences, Tehran, Saudi Arabia. Sir is the Governor for India at the International Council for Respiratory Care and a member of Board of Studies at All India Institute of Medical Sciences, Rishikesh. He is specializing as a course director for lung ultrasound for respiratory care practitioners.
Let me introduce you to Dr. Niranjan Ambekar, a nephrologist in Kidney and Dialysis Center, Ambekar Hospital. He has over 2 decades of experience in the dialysis industry. Sir is also a council member, renal transplant, Government of Maharashtra, and has a founder member of Indian Society of Nephrology, and has many more accomplishments to his credit. With this brief introduction of the erudite speakers, I would like to hand over this session to Dr. Shabnam Singh.
Thank you so much. Am I audible? Can you hear me? Great. So this is really the session which you're dying to be, that it should be over, but I promise you, it's between you now and lunch, but it's the most interesting session. My compliments to Symbiosis for the fantastic stellar work that is done here and how contemporary they are. Really a big round of applause for Symbiosis. The vision of being contemporary actually applies, in your case, the maximum. And I'll just tell you why. As briefly said, around 22 years ago, we started a hospital in Delhi. It was supposed to be just one hospital. But given the amount of need, it's catapulted into 14. 14 hospital bane. And what is the biggest learning in that journey? That for every doctor, you needed 20 other people. And those 20 other people were not nurses. Everybody automatically thinks, nurse chahiye. Nahin. There were only 3 nurses per doctor that were needed, at least in the way we practiced. And the rest of them were people like yourselves. And as time went by, this became more and more critical. And in its criticality, all hospitals all over the world found that maximum evolution, maximum shortage, maximum lack of talent was amongst this cadre. But उस समय इसका कोई माई बाप नहीं था. Therein comes Symbiosis. So big round of applause to Symbiosis for having stepped in. So you had a plethora of small, medium, paramedical institutes. As people who hire, Dr. Senthil Kumar is here, Dr. Ambedkar is there, he will tell you as a doctor, we had really no way of knowing that if you applied for a job and said, I'm a radiology technician or a lab technician or in new evolving fields, उस समय oncology बढ़ रहा था. There was no way in knowing whether you had been trained properly. So you'd pick up the phone and you'd ask the last employer, काम जानता है कि नहीं? कितने साल तुम्हारे साथ रहा है? That's no way of hiring anybody, right? And that's no way of learning also. Yes, it's a great way of OJT, on-job training, but does not actually tell you what the person is all about. So at that time we realized this is going to be the future that is disastrous if we don't actually look at what regulation is about. तब तक सबकी learnings थे, Medical Council of India, Nursing Council, you had a session on the Nursing Council, and we said, let us learn from them. There were good things and not so good. So we won't carry forward the not so good, but we will put together the good things. So collectively, that is how the Allied Health Bill took place. It took only 10 years for it to reach here. Can you imagine? 10 साल. 10 साल लगा है उसको यहाँ तक आने में, पर आया तो सही है, right? So, good thing, it has finally arrived here. The not so good, I will ask my fellow panelists to walk into. Before handing it over to them, I just want you all to understand and really take it home. Today you have joined a course in Allied Health, right? But your journey doesn't stop here. This is just the beginning of your journey. As healthcare is evolving and as care has been amply demonstrated in COVID times, it's going to move into the house. And guess who is going to provide that care in the house? You all. You all. If you ask me today, what are those job roles? I honestly cannot say. But I can, with a hand to my heart, say that when the PMJ insurance cover was started 2 years ago, overnight a job role which was called Ayushman Mitra was formed by us. Because there's nobody to be able to type in the data that is needed for a person to be able to access care. I'm giving that example so that you understand it, right? Every day some new technology comes into the hospital. Dr. will speak about it. There are no technicians for it. So be very open in your mind. The sky is the limit, and you will really, really go forward. So with that, now I'll quickly run across the first session of questions. Dr. Senthil Kumar, you run a prestigious institute. You've been doing this for the last, what, 10 years now?
25 years.
25 years. He will share his experience as to where they were and where they are today. Over to you, Dr. Senthil Kumar.
My sincere thanks to the organizers of Symbiosis for giving me an opportunity to share my views. The way back in 1995, this allied health science was introduced in India in Sri Ramachandra University. That time, we introduced with 60 students with 6 technologies. The 6 technologies are radiology and imaging, dialysis, anesthesia, neuroscience, urology, like that. Slowly, as the stakeholders, the doctors, the hospitals, when they came to know about that, they started inquiring about this program and they wanted the allied health professionals to work in their hospitals. But first when it was introduced, the doctors themselves hesitated to run this program. This success of this program is basically depend on the doctors. So we thank the doctors who have run this program and to come up like this state. So now in India, every state knows about allied health profession. Previously, only very few states had known about allied health science. So now we are running nearly 15 technologies. And these 15 technologies are all job oriented. Immediately they get a job. And the COVID has proved that these allied health professionals are boon to the healthcare. So what happened? The success of the story is, first thing is you should have a competency-based curriculum. Your curriculum must be very strong for the success of your program. Infrastructure. Infrastructure plays a major role because the allied health professional, when it was introduced, there was a conflict between the nurse and the allied health professionals. Till that, nurses were only taking care of all this. Then they had to understand the allied health professionals are between a doctor and a nurse. They mainly work on a machine. So when the doctors understood this, allied health professions are really helping hands to them. When we had a discussion, the physicians and the doctors, they gave us a strategy saying that previously we were seeing 10 to 12 patients per day. When the allied health professionals entered into this field, now we are seeing nearly 20 to 25 patients. Because these are the professionals who does the work and keep the report on the table. So the doctor believes the allied health professionals. So for that, the allied health professionals must be highly knowledgeable. They should be skillful. They should think that they are in a do or die situation. The report they are giving is signed by a doctor who believes that you have given a correct report. So then only this profession can have a success. And the students have proved, in all universities, the students have proved that they are talented, they are knowledgeable, and they are skillful. So slowly what happened, this undergraduate program now became master's program. In many universities, master's program have been started. Why? Because in some universities, the UG program has to be conducted by this master's candidates. So now they have understood, like physiotherapy, occupational therapy, nurses, now they have understood even this allied health science must possess a master's degree. So now, even though we have master's and undergraduate program, what happened? There are very shortage for this allied health professionals. The government decided and they started certificate programs. Health Sector Skill Council started certificate programs for so many courses. So that immediately they can go and work in a small hospital. When you want to work in a large hospital or a big hospital, you need a degree program. When you want to work in a small bedded hospital, 20 bedded hospital or a 15 bedded hospital, this certificate course is enough. But any education does not stop with the certificate program. So any person will think that I should achieve more. So if you have a certificate, you can go for a diploma program. If you have a diploma program, you can go for a bachelor program. From bachelor program, you can go for a master's program. From master's program, you can do your PhD. Now there are many PhDs in allied health science. In radiology, there are PhDs. In dialysis, there are PhDs. In neuroscience, there are PhDs. So starting from a basic technical work, you can go to a level of a researcher. The main thing for the allied health sciences, you must be knowledgeable, you must be skillful, you should get hands-on training. And during that hands-on training, the simulation played a major role. In those places where patients are not available, the simulation centers are set up where the students work on the simulation. Because while working on the simulation, they do not get any fear. Once they get confident, they immediately go to the patient. So in that itself, there are two types of programs, 3 years program and 4 years program. In that 4 years program, it is 1 year internship. So during that internship, the students are well trained. They do not have any exams. They are only evaluated at every end of 6 months. So evaluation also plays a major role, whether it is a certificate program or it is a UG program. At every level, the allied health science professionals are evaluated. Then only they move on to the next step. So this is the story of the success of this academic career of these allied health science program.
So clearly, the career progression is there. Contemporarization of the curriculum is embedded in allied health with a lot of flexibility. Niranjan sir, your years and years of experience in nephrology, working in very dire circumstances as we were discussing, how much do you think has the confidence of the physician moved, like Dr. Senthil Kumar said, that the nurse was the one-stop shop. Machine टूट गया तो nurse repair करेगी. कभी-कभी पहले हम लोग भी लग जाते थे उसमें. But today, given the context that is there, and why I'm asking this is that when we find countries coming to us for trained people, they are insisting on knowledge base, as he said, not limited to the field only, but also to the universe of the equipment that is there. Over to you, sir.
Good afternoon. I'm still a student, by the way. I'm just sitting here, but I have the pleasure of interacting with two of my teachers, Professor Arun Jamkar, who has taught me surgery, and Professor Muzumdar sir, who has taught me botany. So I'm still continuing to be a student. After when Madam read the biodata, I wish my mother was here. She would have had a different impression about me. She still considers me to be a young toddler like of thing. I just wanted to thank Symbiosis for calling me for this program. I have a little bit of interesting case. Can we have the first slide? I just thought I'll tell you where you all are important. I mean, in this era, as Madam said, once upon a time, when we started our dialysis unit or any specialty, the doctor used to be the carpenter, plumber, repairing person, everything into one. Then slowly the sister came inside. She started getting trained. And believe me, now it's very easy for you to call in some technician and repair the equipment. But it is very difficult to do that when you're at a peripheral center. Now, in fact, there are some machines in Pune which don't have anybody to repair it. The person has to come from Bombay. And you know how difficult it is. So it is imperative that all of you not only work as technicians, but upgrade your skill to learning how to repair the equipment. And you can all do that, mind you. I'll just start with one simple case. which I thought I'll just project to you in 2 minutes' time. Okay, this was a case from our hospital. So the problems in dialysis, who is responsible? So you have all this, and this is a very interesting thing. I don't know whether you've seen this cartoon. This man is coming to the dialysis unit, and the typical matron is sitting over there. Lady, do you want to speak to the man in charge or the nurse who knows what is going on? So that is where you are all there. See, the doctor, I go for inspections to multiple hospitals. And then I find that if I ask the nephrologist or the doctor in charge, where is this equipment? He doesn't know. So it is all dependent upon you. And the dialysis units are, most of them, managed by technicians and sisters. So we have a program which we hold every year or every 6 months to upgrade the knowledge of dialysis technicians. And unfortunately, because of COVID, we were not able to keep any physical program, but we had a virtual one. Actually, Madam had suggested this slide. This shows that this is a great collaboration between the academic person, okay, then the application specialist, and third is the industry. So for any program to become successful, you have to have a collaboration between all of them. So remember one thing, that this is not something which is in any department where the doctor is different, the sister is different, and the technician or the allied specialist is different. No, they are all together. We work together as one unit. Everyone knows about what is going on. As Professor Senthil Kumar said, my only request to all of you is one thing. Please, whatever, if you have a difference of opinion, Dr. Senthil Kumar and Madam will agree, keep it to yourself and do not shout at your juniors. Because you see, you remember that the patient is listening to whatever is going on. And he knows that if there is some problem, see, these are all machines. Machines can give trouble any part of the day. So take the person, junior person, to the side and explain to her that whatever she did was right or wrong. And do not ever shout or scold anybody, because patients are very smart. I'll give you a small example that one of the patients who was monitoring the dialysis unfortunately died about 2 days later in the hospital. A patient was critical. So one of the relatives came and told me, yes, you are absolutely right. The patient was critical, but I'm happy that today's dialysis went off well. I said, what do you mean by that? Oh, she said, the patient said that the machine was giving lot of alarms yesterday and the sister could not handle it. So, ladies and gentlemen, don't ever think that your patients are not observing what you're doing. Everything is being monitored. And they can question you on this aspect also. I'm not scaring you, but there have been cases where the medical authorities and the technician and sister have been pulled up for any problem that has occurred to the patient. So be careful when you are doing this. This is one small slide. This is an interesting slide. This shows the difference between the cardiologist and the nephrologist, and also the financial differences between both of them. Yeah, so I'll just go to this case. You see, this was a lady who came for dialysis, absolutely all right. She was quite comfortable. As you can see, the blood pressure was 150/90. And for hemodialysis, she was given these orders of dialysis, taken up, and dialysis was started. Suddenly, the blood pressure dropped, and the patient had a cardiac arrest. Now, we were all scared. In fact, the technician and sister came over. The patient was unresponsive. There was no pulse, there was no respiration. So first of all, do not treat any procedure lightly. You remember that there can be lot of problems. Now what happened is, we gave her cardiac resuscitation, breathing, and normal saline was given. Now what happened was, blood pressure rose up and the patient improved. ECG did not show anything. The X-ray also was normal. Now, why did the patient become unresponsive? That was the question which was in my mind. I couldn't find any answer, but was it because of all these other factors? Not sure. What happened was there any other cause? Actually, the blood pressure, the fluid that was removed during dialysis was only 600 ml. So I couldn't answer this question. So what happened is, we just gave her saline, she improved, and she was shifted into a major hospital. Okay, so this is the patient after the treatment and after the resuscitation. You can see she's standing over here. Okay, what else happened is, there was a problem. This patient was saved by my technician, dialysis sister, and the attendant. Now, a pulse rate, a blood pressure which was 0, suddenly the patient responded to treatment. Now, why I'm telling you all this is that these 3 pulled out that patient. So remember, when you are treating a patient, it's the life of a patient. So you must be always attentive, always keeping a watch. And you know what was the problem? The problem was that it was the machine that was giving trouble. See, it was this pump. And that I would have never found out. It was the pump that gave trouble. And this was found out by the technician. So I'm just telling you, I call it clinico-pathological correlation, which is also termed as completely puzzling and confusing, because you never know what is going on. So I just thought I should discuss this case with you, and you should understand that in practice, there are several things that can happen when you're treating the patient. You should be always attentive. Apart from what can you do, I think we'll take the second round of questions, right? Thank you.
Right. Thank you so much, sir. So now, amply demonstrated what is the value of the allied health professional. As I'm reiterating, in all seriousness, going forward, the delivery of healthcare is changing. Telemedicine, virtual consults, home care, acute care at home will all be done by you all. So therefore, what Sir has demonstrated and shown is that you have to work as teams. And in that team, you are a very, very critical component. I don't know how many of you have seen ants picking up a small piece of grain. एक चींटी तो उठा नहीं सकता है. It's always you will find the larger the piece, the more people who come together to make it move. So healthcare is like that. You need far many more people to make this piece move. We'll switch tracks now. So you've trained, you chose this career, but you need to have a job. We've demonstrated and shown to you how important you are. But hey, all the doctors and nurses are going abroad. I also want to go abroad. What is it? What is the system to go? How do I go? How do I go abroad and get a future degree? Like Dr. Sanjay said that he went and he got his FRCS. Like that, in technology, there are a number of certification courses. Jithin, you're in UAE. You've been in Saudi Arabia. And you, with your respiratory therapist training, which was like the most critical person in COVID. Would you like to share with our young, bright minds?
Thank you, Madam. Thank you, Madam Singh. Being the representative of the most celebrated profession called respiratory therapy during the pandemic, and on behalf of the Indian Association of Respiratory Care, I thank the symbiosis authorities, higher authorities, starting with Dr. Jadhav and Dr. Rajiv and everyone who worked behind this. Thank you for bringing us together in this platform. Thank you for trying to create a big message which is going to be spread across the nation and at an international platform as well. I would like to say it in a different context. I would like to start by saying our role that we played as a professional organization, in reality, in bracket, virtual. We were sitting in Saudi Arabia, we were running the society here in the country. Our role during the pandemic and before, starting this society in the year 1995, and here we are celebrating, or celebrated last year, the 25th year of inception of this wonderful profession in the country. We feel the role of a professional organization, and we are working based on that 4 core principles. They are, number 1, setting the scope of practice and standardization of the practice, starting from the curriculum standardization to writing the policy and procedures at the real practice areas, whether it can be in clinical or at the industry levels, research, outpatient levels, home care, and so on. That is number 1. Number 2 is advocacy, professional advocacy. We work, we raise noise all the time. We are here. Whether somebody is hearing it or not, we never cared. We raise the noise all the time. Third point is continuing education, which is the sole responsibility. We take it as a responsibility of the pioneering leadership team, as the seniors, to pass as a message the education, and the importance of education is never ending. You have to keep on trying to get trained, acquire knowledge as much as possible that you can. Fourth point is research. We work to establish, do research within our scope of practice. We do establish our own journal, which is running its 10th year, self-funded from our pocket. We share the money that is required for publishing this journal. That is 4 issues in a year, which is for promoting the research that our own people are doing. And when they are not getting a platform in other journals, and it is highly paid or sometimes cost is involved, we have to support them. So we work on this research. And finally, we found there is a need for registry. A registry need to be maintained. Any respiratory therapist who complete her or his degree in this, from this country is getting registered with us. And we are having a complete mapping of what they have done, verifications, everything that they require while they pursue a higher education as well as a job out of our country. So this is what we are doing. And this is what is supposed to be done by every professional organization. And when you look at from an international perspective, all these are what we are missing in our country, in the practice. There is no scope of practice defined by the system saying that this is your job, creating conflicts. And I use this particular platform and take this opportunity also to hats off to every individual allied health professional who is sitting here. They are getting job. It is not because of the system. It is because of their own effort. They are going out, talking about themselves. They are trying to convince the administrators, employers about what they are doing and they can do. And they are getting a job. Initially, they will get a very low payment, and gradually, and with fortune, sometime it will go up to next level. Ultimately, that will lead into a complete brain drain phenomena, that we are losing the typical good candidates who actually should work for our system in our country. They are going to work abroad, including me. I see myself also in the same position. When I was applying for a job there, when I was applying for a higher education plan, whole thing falls into this lack. What is that? It is from defining the role of you as a professional in our country, our home country. I hope that clarifies your question.
Thank you. Thank you. So he's brought out a very, very important point, and that is registration of all allied health workers. So the Allied Health Bill is geared towards that, right? So it's been passed by Parliament, and now, like everything, you need to go through the process, legislative process of rules and schedules to be put in to address exactly what he says. Carve out the scope, what you can do, what you can't do, what is going to be your curriculum, and how it's going to move. The other thing is that health is a state subject, right? So you will have state boards and you'll have a central board. Now the issue is to standardize the whole thing, and that is going to take some time, Dr. Senthil, as we all know. So in the interim, given your 25 years of experience and the fact that every human being wants to go up the value chain, they don't want to be jogging like Brownian movement at just one point. What do you suggest is the best way in the interim to address this? And I've had the recent experience of Japan, and when I talk about new job rules, geriatric care technicians, Japan needed 75 overnight, and I'm not kidding you. It was literally the message came overnight. So we had to take the general duty assistants who had worked there, register them in the Ministry of External Affairs, and send them. So in that kind of demand-driven market, how do we address this? Over to you.
Thank you, ma'am. So basically the bill has been passed, but the council in the state has to be formed. So each and every state has to form the council at the earliest. So if the state council is formed at the earliest, the question is answered. But definitely, according to our meetings, we see it will take another 2 to 3 years to form that. In between this, the societies which they can form, every technology can form a society, and for that society, they can give one temporary number. Once when the council comes, they can finally register them to the council. Till that associations, for example, Respiratory Therapy Association, Dialysis Association, like that Indian Association of Dialysis Technologists, Indian Association of Respiratory Technologists, till that they can give one number based on their educational qualification which they produce to them. That can be taken as, but when you enter into foreign countries, you have to write one exam, or we can keep one exit exam in India and we can give them one licensing number.
I think that's a great idea, the latter, that you have an exit exam. So, sir, Dr. Niranjan, recognition of prior learning is a well-established way of bringing certification to uncertified people. So they are competent people. I don't know, how many of you have heard of compounders in yesteryears? Raise your hands. Yeah. So actually the compounder did everything. They did everything, and you couldn't see a doctor without the compounder actually giving you the last, as you're leaving the door, he'll give you his 1 or 2 gyan, little pearls of wisdom he would give. So what do you think, sir? That is a huge sea of people, and it's not only allied health workers. In England, for instance, all doctors work under a specialist, work for 4 or 5 years, and they do an exit exam, and then they become endocrinologists, diabetologists, whatever you'd say. So what would your solution be for A, the career progression issue, as well as recognition of people who are already well qualified as far as their knowledge and competency is concerned. Your point, sir.
Yeah, thank you. Actually, this is a very important question which is asked to me by people who start their program. They say, what are we going to do after we graduate? So believe me, you may not know it, but several of my own dialysis technologists have now started their own companies. They are marketing their products because believe me, the carpenter never blames his tools. So he knows what is what, and he can give you the best advice. So any person who is starting, because many of the time technology is so advanced now that it's very difficult. For example, now I'm sure at our times there were no computers, smartphones were not there, but now they have become a part and parcel of everybody. Technology. So what I feel is many of these people, what are the avenues they have? One, you can become a researcher, which is a very important branch, not so common in India, but still it is under development. One. Second is you can, as you, sir said, do your PhD, and then if you are an entrepreneur, you can start your own company. You can do marketing, and believe me, most of the people in the industry that are there, like Fresenius or Gamro or all these Nikiso, Nipro, all these major players will like to recruit people from their old field who know about, because they are the people who can advise. You see, it becomes easy for them. Instead of sending an engineer, you send a person who has worked in that particular field, and he can manage the system, he can talk to people, he can convince them. It's much better. So believe me, it's like, don't think that I have become a technologist, so I will only restrict myself to this. My own nephew did his BE Electronics, then did his CFA, which is Certified Financial Analyst, and now is working in HSBC Bank. Now, this means that he has diversified. So there are a lot of avenues open. It's up to you to decide what you want to do in life. And you can certainly go ahead, and maybe sometime if there is job availability, I will work under you. Thank you.
I agree. So you will employ us. With that, I'm going to open it to the floor to all of you, as jobs are very important. After all, that is why you're here, to learn as well as to get a job. And you will address the questions to Jithin, because I'm sure all of you want that path that they have taken, charting themselves out into an absolutely new but very relevant field in countries where they're really paid well. So anybody would like to ask a question to Jithin, please? Anybody in the audience? Who wants to go to Dubai to work, or UAE, or wants to go to America? Any questions from the audience?
If you don't ask, sir will ask 2 questions. So.
Yeah, he's going to ask you. We have 5 minutes to go. No hands. Don't feel scared about all your professors here. I promise you they're not going to bite you. Yes, please.
Thank you. Am I audible to all? Thank you. Hi, ma'am. Hello, everyone. My name is Manjush. Let me introduce myself as an alumni of Symbiosis. I've done my bachelor's, master's, PhD in Symbiosis. And I'm a respiratory therapist by profession, and I'm currently employed in Abu Dhabi as the program director for respiratory and emergency medical care. My question is to all the panel members here. Just want to have a clear idea. We have been hearing about technologists, technicians, therapists. As far as I understand, I'm talking about the respiratory care profession. I'm sorry, if there are other people around here, they can actually raise the same question. Now, as we know, therapist stands for therapeutics, the one who treats. We never call a physiotherapist as a physiotechnologist. Do we call occupational therapist as occupational technologist? No. because they are a part of the therapeutic team. Similarly, my question will be specific to Jithin. The reason is we have different grades in respiratory therapy, like respiratory technician, we have respiratory technologist, and we have respiratory therapist. Would you be able to differentiate between these three? Because I have never seen a physiotherapy technologist or occupational therapy technologist. Whereas I have seen, we have dialysis technologists, we have lab technologists, etc. So as far as I understand from my profession is, in my profession, I'll say my profession, we have diagnostic area, we have therapeutic area. So when they complete their 4 years of education, how are they going to be called? Are they technicians or technologists, or are they clinicians? Now, just want to put one more word here. We have 4 years of education here, right? But where I'm working right now, it's a 5-year program. It's a 5-year program in respiratory care in Abu Dhabi. So I just have this specific question to Jithin and the general question like how are we going to diversify technicians, technologists, and therapists in this era and the upcoming era? Thank you.
Thank you, Manjush. That is a very valid question, because you might have faced the same issue maybe in your specialty as well. If you look at your profession, some areas it is said as respiratory technologist, and the universities in that state is offering programs as respiratory technologist. Some area they are, states, they are offering programs as respiratory therapist. Here what we require, basically, fundamentally there is no difference. The curriculum, what has been taught is same. The training that they are undergoing is same. The duration of the program is same. Only name is different. Only the name. There are some areas, based on their requirement, they don't want to name somebody as therapist, so they just call them as technologist. Okay, this is number one. Number two, professional organizations and the governing bodies have a clear role in defining this. What is therapist? What is a technologist? What is a technician? And in the Allied Healthcare Bill, it is already defined. Anybody who has a graduate program or education above 4 years will be called as therapist, and below that is technicians and so on. So that criteria, maybe madam will be able to explain to us very clearly. That is number two. Number three, we are still looking for internationalization, and Symbiosis as a prime university has great vision in that aspect, where we are also looking for, as Dr. Dilip in his speech today, what he mentioned is about student exchange programs. So let us look at that aspect now. What is the international standards that they follow this? It's all over respiratory therapist. Then how respiratory technology came, that technology, the word technology came, is nobody knows. Okay, but our students, our graduates have faced tremendous issues when they seek for job opportunities outside the country, and when they are applying for their higher education in different countries, they faced tremendous issues. And we as a professional organization would like to, we're able to manage this by getting involved to this, by proving them both are the same. But that will not happen all the time. That will not happen all the time. So we have to define it at the policymakers level, at the university levels. They have to understand, if you wanted to get international students to pursue your degree, that should match their job profile there. They are going to come here and do the masters after, maybe from your university, Dr. Manjush, maybe after their BSc RT program, they will never come and do a technical course for their master's program. They are already a therapist. Their defined criteria are already defined that you are a therapist, not as a technician. Hope you understand. Hope I'm clear about that point as well.
Thank you, Jithin. This is a situation of what is called equivalence and international portability, right? And in the equivalence, what happens is each country looks at their curriculum, and there is a definement which comes through what we call GATS, general services between countries. And then you match it according to that to give the equivalence. But world over today, the understanding for allied health from WHO downwards is that it is very critical that we have unified terminology. So it is being worked on, and that is precisely why this bill is in place, so that there is unification and no ambiguity in X, Y, Z making their own degree or their own curriculum happen, right? So thank you so much, panelists, for your inputs. I know this has been a very practical, it's like an OJT, isn't it? It's a bit of an OJT for all of you. I hope you enjoyed it and you will continue to pursue your dreams in allied health. Thank you very much for having us here.
Thank you, Dr. Shabnam Singh, Dr. Senthil Kumar, Dr. Niranjan Ambedkar, and Mr. Jithin Sridharan for this enlightening session.
As a token of appreciation, I would like to invite Dr. Rajiv Yeravdekar, Dean, Faculty of Health Sciences, Symbiosis International University, to felicitate Dr. Shabnam Singh, Dr. S. Senthil Kumar, Dr. Niranjan Ambedkar, and Mr. Jithin Sridharan.
The last time we were together, I was giving human bones because of part of anatomy education to him. So this time it's a pleasure to receive something else.
I request the panelists to please stay on the stage for a group photograph.